I hope you're doing well. Let's continue with our second lecture on sex chromosomal abnormalities and look at Klinefelter syndrome. Klinefelter syndrome is the presence of two or more X chromosomes plus the Y. The phenotypic result is a male, and the clinical findings are non-specific during childhood. The diagnosis commonly is made during adolescence and adult life in males with small testes, and they start to develop breasts. Virtually these men are infertile. So what is the etiology for Klinefelter syndrome? The major etiology is non-disjunction, which occurs during meiosis, and the percentage of the disjunction that results from a paternal side is 50 to 60%, as compared to the case of Klinefelter syndrome that results from the maternal disjunction in meiosis, which is 40 to 50%. In general, Klinefelter syndrome encompasses specific clinical consequences that are observed in men with this karyotype XXY. Normally, you're supposed to have only X and Y. So any addition in this brings about a genetic abnormality. So other variants include having an additional X, or can have an additional Y chromosome. For example, normally an individual is supposed to have this, but then here they have an extra 2 X chromosomes. And in this case, also they're supposed to have this for a normal individual male, but then they have extra 3 X chromosomes. And then in this case, they're supposed to have this. So here they have both. They have an extra X chromosome and they have an extra Y chromosome. Men with this karyotype have similar but more severe phenotypic features. In other words, as the number of X chromosome increases, the phenotypic severity increases as well. So this results into cognitive impairment, that is decrease in IQ, impairment in gonadal development, and cardiovascular and skeletal manifestations. The cardiovascular manifestations that may be present in these individuals include congenital heart defects like patent ductus anteriosus. Then you also have you can also have very many like stenosis of the mitral valve can be present in this individual. Then even you can have the skeletal manifestation like spina bifida, which might be present in these individuals. Also, you can have mosaicism in Klinefelter syndrome. In this case, you have a man, but within this individual, some cells contain the normal number of chromosomes, that is 46 XY, and then some cells contain 47 chromosomes within the cell, meaning there is an extra X chromosome, but this is within the same individual. So in other words, mosaicism is the existence of different cells within the same individual. In other words, these cells that contain different number of chromosomes but within the same individual. So this picture summarizes the X-tics that are present in a man with Klinefelter syndrome. Frontal baldness is absent, poor beard growth, which is not normal for a male supposed to have fast beard development. Then there is a tendency to grow fewer chest hair, and then narrow shoulders. As a man, genetically developed well is supposed to have broad shoulders. And then you have breast development, of course, which is typically for a lady instead of being in a man. And then you have the female shaped pubic hair pattern. You know, as a in women, this is the pattern of hair growth, and then in men, this is the pattern of hair growth. So if there is a female type pubic hair pattern that is typical for Klinefelter syndrome, and then small testes and long arms and hands. The small testes, this also contributes to the fact that these men are infertile. There are certain complications and comorbidities associated with Klinefelter syndrome, which include congenital abnormalities that we have seen earlier, like congenital heart diseases, spina bifida, and then you have this high prevalence of breast cancer and testicular cancer, plus leukemias. And then autoimmune diseases also, there is increased chances in these individuals to develop autoimmune diseases like lupus erythematosus, and then you might have some neurological manifestations like convulsions. They also at increased risks of getting bone fractures due to osteoporosis, and endocrinological disorders like DM are also common in these individuals. How do you diagnose Klinefelter syndrome? Basically, there is history taking, and they can bring out features like breast development, and then on your physical exam we shall find out some of the features that we have seen that are associated with Klinefelter syndrome, like lack of beards in men, small testes, and depending on severity of the genotype abnormalities. And then we shall also do karyotyping, which will help us to actually understand and get to see the genetic makeup of these individuals. And then we can also do hormone levels. Follicle-stimulating hormone, luteinizing hormone might be increased more than normal in these individuals, which is typically abnormal for a man to have so much follicle-stimulating hormone and luteinizing hormone. And then you can also do testicular biopsy to also rule out some other conditions that might be resulting to these features in these men. And then how do you manage? Basically, you want to correct the genetic abnormalities in these individuals, but you have to inform the individuals about the condition such that they are aware about what is happening. Then you also have to give them lifelong testosterone therapy to develop the male sexual characteristics and for better psychosocial function. And then also you can do surgeries to correct some defects like the congenital heart defects. Those can be corrected so that you improve their level of comfort and living. Otherwise, thank you for listening. I hope you have learned something. Meet you in the next lecture.